Thank you, Katie. Good afternoon, everyone. I'm Michelle Glass. I use she, her pronouns, and I'm one of the co-chairs of this committee with Amy Fellows. Thank you to all the folks who have joined. I hope that folks are having an okay day with the storm and that that's not going to interfere with our Zoom meeting too much. But if it does, feel free to turn your camera off if you're struggling with bandwidth. And staff, is there an opportunity to call in just by phone if internet goes out?
Yes, I'm trying to think of the best way to communicate that. Yeah, I will think about that and get something going in a moment.
Okay. So yeah, so just let us know. Probably an email to maybe directly to staff would be the best way to communicate if you're having trouble staying connected to the meeting. So thanks again for being here and welcome to the November Community Engagement and Communications Committee meeting. I think we can go ahead and get started and let folks join as they are able. So we are going to do a quick tech check. Staff is going to support us with a roll call. We will review the agenda, but I do just want to acknowledge at the beginning of our meeting that a lot has changed in the world and in the policy landscape since we last met. And I just want to reiterate that nothing has changed for our task that the legislature asked us to accomplish with Senate Bill 1089. So want to acknowledge that people may be impacted in this room in many different ways and may be feeling a lot of different things in response to all the things that have changed, and want to be mindful of that. And also just want to reassure folks that our task under Senate Bill 1089 hasn't changed and won't change unless the legislature gives us new direction. So I hope that that is helpful. And I know that that may be a question in folks' minds. And so we will, I think it has always been the case, but to me, it's certainly still the case that the most inclusive, thoughtful, careful work that we can do to engage Oregonians and build a plan that can be implemented to improve people's lives, whether that's tomorrow or in a decade. It's still our work and it's still critically important. And the foundation that we lay, I trust, will be used to implement a plan that's going to be universal and improve people's health and well-being. So I don't know when that will happen, but I remain committed to doing that thoughtful, careful work. And I'm really grateful that you all are here to do that work with us. So just wanted to acknowledge that piece. Is there a slide for the tech check? Great.
Yep, thank you very much. So just a reminder for those joining, we do have Spanish interpretation available. So with that, you will need to select either if you click on interpretation, you'll need to select the English channel or the Spanish channel. So that's just really quickly before we get started. But just a reminder on how, if you would like to view just the speaker or the gallery view, the directions are there. Also a reminder that this meeting is open to the public to view. They can't participate, but they can definitely they're here and attending. So with that, as a committee member, if you're able, please keep your camera on so that we can decipher who is committee members and who isn't. And then also stay muted unless you raise your hand and want to participate. So then use the raise hand function, and then Michelle or Amy will call on you to speak. And other than that, if you have any technical issues outside of that, please feel free to reach out to staff at any time, just those as needed. So from here, I think I'll go ahead and jump into roll call. Wonderful. So when I say your name, please just say here or present to acknowledge that you're with us today. Michelle Glass.
Present.
Amy Fellows.
Here.
Grace Hokog.
Present.
Did we lose you?
Grace, were you there?
Yes, sorry. My internet may have cut out, but here.
Are you guys hearing her okay? Okay, perfect. Mickey Dirting. And I wasn't able to hear Mickey. Did anyone hear Mickey? Mickey, are you able to come off mute? Okay, we'll circle back with Mickey. Juan Pablo. Colin Stackhouse.
Present.
Max Brown. Jensina Hawkins.
Here.
And Jensina, I'm sorry, I think I'm having a little bit of audio issues on my end.
I'm here.
Okay, perfect. Thank you. And Jay Brown.
Present.
John Buzzard.
Here.
Craig Newton. Yesenia Hernandez.
Present.
Katie Koenig. And Jocelyn Ogden.
Here.
And then also, I know I had mentioned to, if you're able to stay on camera, please do. But of course, with the storm and with any type of technical issues, if you need to come off camera at any time, that is absolutely okay. So with that, I will turn it back over to you, Michelle and Amy.
Thanks so much, Katie. And again, just welcome everyone, and we'll figure out the tech issues as we move forward today. I'm grateful for all of your time. I'm going to quickly review our agenda today. So hopefully you can see the agenda on the screen. We're doing welcome, roll call, introductions, and agenda review right now. We are next going to be able to introduce Deanna Bianco to you all, who is a skilled contractor who did some work with the Universal Health Plan Task Force previously and has agreed to support our work again. So really excited for y'all to meet her. We are going to review committee member public engagement. So just realized at our last meeting that we didn't have a chance to share with all of you the ways in which our committee is subject to the same guidance that the Universal Health Plan Governance Board itself is subject to. So we're going to chat about that today. And then we're also going to bring forward the values and principles that the Universal Health Plan Governance Board developed in our first months as a board that also guide the work of our subcommittees, which is all of us here. We'll also get a chance to review existing structures in meetings for outreach. So talking about the groups that were identified and emailed in. So thanks to everyone who shared those ideas for that brainstorm. And we're going to talk about who might be missing and how we want to engage with those folks moving forward in our timeline. We will have a chance to hear a presentation on how another Oregon state government group has done some public engagement similar to what we have been tasked with doing in response to other legislation. So thanks to the Oregon Advocacy Commission for being willing to present some of your process and outcomes for public engagement. And then we'll have meeting reflection and a discussion of future topics that you all would find helpful for our work together. Touch on some committee resources that are available, and we'll have public comment and close out. So that is our task today between now and 3 p.m. And with that, I will turn it over to Deanna from Artemis Consulting. Thanks so much for being with us.
Hi, thanks so much, Michelle. My name is Diana Bianco with Artemis Consulting. I use she, her pronouns. And I'm so excited to be with all of you today. And some of you I've worked with in the past and others are new to me. I'm just going to do a quick introduction and then happy to answer any questions or hear any comments. I am a longtime health policy consultant. I'm based in Portland. Most of my work is in Oregon and Washington, though I do some national work around increasing attention to and investment in primary care as well. I've been in Oregon with just a few years away since 1995, and I moved here because of the innovation that Oregon was doing around health and healthcare. So at that time, the Oregon Health Plan was fairly new. And I came here to represent people with disabilities after law school under the new Oregon Health Plan. And I work in health and healthcare because I see it as an issue of social justice. And I've been working in this field since I started back in 95. My current work, so I'm a consultant, I'm a sole proprietorship, one-woman shop, and I do a lot of strategic advising of a lot of different groups. I work with sort of a variety of people to design and make recommendations around policy issues. So, for example, I just worked on a project around improving the vaccine financing system in Oregon. And I also do sort of lots of strategic guidance and promote collaboration across groups who want to create a better healthcare system. And I had the opportunity, as Michelle referenced, to do a bit of work for your predecessor group and engaging and sort of doing some engagement with some folks specifically in the healthcare space. And what I've been asked to do in this go round for all of you over the coming months and next year is to engage employers, business organizations, healthcare providers, insurers, healthcare consumers, coordinated care organizations, community-based organizations, and disability-led organizations. So I'm really excited to partner with all of you, to this group, to hear from you, to learn from you, to sort of take in what you want to share. And as I sort of talk with Michelle and Amy and Jenny, and then hear from all of you, sort of put together a sort of design for project to, engagement to make sure it reflects what you all want and need to hear as part of your effort. So I'll stop there. Unfortunately, I can't stay for the whole meeting, but I will stay as long as I can and may try to rejoin in a bit, depending upon how long another meeting goes. But at this point, I want to say thank you for engaging with me. I'm really excited to work with all of you. I think your work is super important for everybody in the state and actually in the country to sort of model what could be. And I'm also happy to answer any questions. So thank you so much.
Thank you, Diana. Any questions before we go to the next agenda item? Great. Thanks so much for that overview. And we're really excited to work with you moving forward. I'm going to pass it to Amy.
Yeah, so we just wanted to bring this forward kind of because I don't think we had this conversation at our first meeting in terms of committee member public engagement. So unless expressly authorized by the board, no member of the board has any authority to speak on behalf of the board. The board operates as a single entity when communicating with external parties. If any member of the board receives a media request relating to the board business, or the member's work and participation as a member of the board, the member should promptly notify the executive director of the request by email. And if any member of the board receives a request to discuss the board's work from interest or community groups, the members should make a request to the chairperson and executive director with the date, topic, and expected audience. Detailed minutes of these engagements will be expected, and the executive director will keep a record of them so that we can know where and who we're talking to. And the board will also develop a community engagement plan for active outreach to interest groups and communities as part of our overall work plan. Is there another slide on this, Katie? I can't remember. Nope. Jenny, staff, do you want to add anything to this in terms of the connection to to the committees in
Sure.
this?
Sure, thanks, Amy. We just wanted to put it out there, like Amy said, when we went over the board policies that all apply to committee members during the last meeting, we inadvertently left out the committee member public engagement slide. And it's just a reminder, we really want committee members to go out and have conversations about the committee work and about the board's work, as long as you are doing so as yourself and as a capacity as yourself, and not in any way giving the impression that you're speaking for the board or for the entirety of the committee. If you are invited by an organization in your capacity as a committee member to give comment, we just ask that you let us know in advance so that, one, we can track it for public engagement so that we know who we're reaching out to, who's reaching out to us, and who we're giving information to. And so that the board can be aware of who, both for record keeping purposes and so that the board is aware of who is reaching out for more information so that we can ensure that we're adding them to the people that we're regularly reaching out to, and that we can add them to the people who get the emails and the updates on what the board's work is. And I'm happy to answer questions if anybody has any.
And I thought I would just kind of give an example, because myself and 2 committee members did do some public comment a couple weeks ago on the morning of election day. So Lane County, the Lane County commissioners on November 5th had on their agenda that to have a resolution to support the work of the Universal Health Plan Governance Board in the creation of the plan. And so myself, Jensina, and Jay from the committee all gave public comment along with other advocates in the Lane County, Eugene Springfield area. And that resolution passed unanimously, which is very exciting. I'm going to have staff send you an email that includes the recording, the resolution language, and also Multnomah County. I'm blanking on which year it was now, but I also have in the email linked Multnomah County also did a resolution I don't know. I want to say it was in the last 3 years, supporting a universal health plan in Oregon. Theirs went a little bit further, where the Lane County one is in support of the board creating a plan. And that partially happened because Lane County Health and Human Services Director Eve Gray is also engaged in this work, and I believe is on the plan design committee. So she's the one that got it on the agenda. But that's an example. So like when I saw that opportunity, I messaged staff and just let them know that I would be giving public comment as myself in support of this, and Jay and Jensina were also there. So I don't know if either of them want to say anything or if anybody has other questions around this topic.
So I have a clarification question on that regarding the board versus the committees. So when we received this invitation to speak for public comment for the commissioners meeting, do we go to our chairperson for our committee or to the board staff?
For committees, you can always, most of you are emailing the, I think it's the info email address, and that goes straight to Katie DeLuca, who is our executive assistant to the board executive director. So if you're copying Katie, that would be great, going into that email, and she'll send it to the appropriate person, which might be a little bit easier for committee members. Board members go straight to the executive director, but I think for committee purposes, it would be best to continue to use that email, and you can copy the co-chairs as well. Thanks for that, Jensina.
And do people have Michelle and my DCBS email that's for the purpose of our work on the board?
I see some thumbs up, and I can make sure that Katie provides that to everyone when we send out information for the committee.
Great. And just to kind of connect this to the next topic on our agenda, which is our values and principles, I just want to emphasize that this is not to make it more difficult to do engagement. It's really to make our engagement as transparent and coordinated as possible. So we want you all of us, it's all of us, that join this work group. We know that you all are passionate communicators, and we all want to facilitate as much communication as possible. We just want it to be fully transparent. So that's the purpose of this. So thank you all.
Jay has a question or comment?
So just to clarify, there's a few other like organizations and committees that I sit on, and this is one of the things that I think is really important to kind of bring to the community. I know in one of the other committees I sit in, it's supposed to be like secret hush hush, which is really kind of frustrating when we're actually needing the community support in this. With this, before we have that conversation with the other committees or organizations, are you wanting us to email the info first and just let you know, hey, on November 15th, I'm going to go have this conversation with this person, and then follow up with what was discussed? Or do you just want us to, like, how do you want us to manage how the conversation went as well?
I'll jump in. So generally, I think that letting us know ahead of time that this is who you'll be doing outreach to, so that we can inform board members and everyone's aware of that. And I think unless if it's an individual conversation, someone that you're just going to be talking to, like an individual person, I think the heads up is fine. It's more for when you've been invited to give a presentation or to speak to a large group. And you might be speaking to that too, Jay, with some of the organizations that you would be speaking to. You could send us, if it's like a board or an organization that keeps minutes or keeps recordings, you could send that as follow-up. So you don't have to like write out a detailed explanation. If it's a public forum, obviously, like if they keep any sort of minutes or recordings, you can provide those. And if not, I think a short explanation to just say something to the extent of, you spoke about these topics related to the board. It's not like we're looking for, word for word, but just so that the board is aware of what kind of communications board members and committee members are having with other organizations, so that there isn't any confusion about who's speaking when to whom. And like Michelle was saying, there's also, in addition to transparency, there's also the idea of ensuring that we are meeting with enough organizations and groups that we're really capturing a full picture of Oregonians, so that we as a communications committee can take a look at who's been met with and maybe who we're leaving out too. Does that answer your question adequately, Jay?
Yes, the last question that I had is about testimonies as well. So sometimes there's just people who are going to go represent like kind of a broad topic, right? So when they ask for our feedback and are like, hey, do you mind sending in a quick rundown of what it is that you guys are doing? Would you like a copy of that as well in the email before the meeting takes place?
Yeah, that would be really helpful. And I can't say that there's like hard and fast like examples that I can give you at this point. And I think as we evolve over time, the idea, like Michelle said, is just to be as transparent as we can. So any materials that we can keep and have on file to explain like what was said to this organization when, and to ensure that we're collecting that outreach and we know who the committees and boards are talking to, is going to be what we need.
Colin?
Yeah, I have a question about, I think, bouncing off Jay's and everyone's like the conversations we're going to have over the next couple years. I manage the Healthcare for All Oregon social media channels, and so on TikTok and Instagram, there's like kind of an endless, like once a week there's like a question, and so I'm available to like collate those questions and share them somewhere. Would that be best to the communications committee, or straight to Katie at the info email, or what could I do with that?
So I think that is a great question for the committee to weigh in on. there's a resource out, it sounds like Colin's saying there's a resource out there that could have a lot of information from a diverse group of people all over the state. What, as the communications committee, community engagement and communications committee, would we want to recommend in terms of collecting that information? Is that something that the committee would like to, have included in our meeting materials where the committee could see those questions and Colin could collate them and bring them in? I'd love to hear from committee members. Go ahead, Colin.
A little more context. Usually if people are saying, I don't even know where they're from, but people will say, I want this, and I just regurgitate, please reach out directly to the communications committee or to the governance board directly. So that's like something I've just been saying over and over, but even with saying that, I can bring the specific questions to someone.
I see. Thank you. I misunderstood. Michelle, please go ahead.
Thank you so much for bringing that up, Colin, and also for that sounds like incredible work outside of this committee that you're doing. Just speaking for myself as a member of this committee, I would be very interested, and I know that oftentimes when you ask folks who have taken one action to like take 3 more steps, like email whatever to this email address, we sometimes lose that that communication at that point. So I think anything you are able to capture that you could send us as a summary, I would find really useful unless other board members see it otherwise. And I'm really grateful for that offer. I'm seeing some head nods.
Yeah, I definitely think that would be helpful, Colin, if you're able to share that. Because I was thinking the same thing, that like someone might say something to you when you're interviewing them, but might not take the step to email us, and we don't want to lose what their thoughts were.
Okay, sounds good.
All right. And so I'm going to move us to our next agenda item, which is the board adopted values and principles. So I love how interconnected all of this work is. In order to live into our values and principles, we do need some policies, right? And I think it's really important to keep those policies connected to our values and principles. Otherwise, it's just bureaucracy. So to talk about our values and principles, I was part of a subcommittee of the Universal Health Plan Governance Board, along with Amy and Warren George, Dr. Chenwei Chi, and Deborah Diaz. And our task was to look at the stated values and principles in Senate Bill 1089 and look at the task force report and think about the work that has been set before us by the legislature and decide what else we might need as guiding overarching principles and values for this work, to support this work, to build structures around. And we had a lot of really thoughtful discussions. Those were all public meetings. They're on the website if folks want to learn more about what that process looked like. But this is what we came up with, what's on the screen here. So our 5 overarching principles are health equity, right? Which means that we want to close any gaps in terms of people's health and wellness based on unfair characteristics like where you live or your race or ethnicity or your gender or what have you. So we want everyone to have an equal opportunity to achieve health and wellness. We want to maximize health. So again, really focusing on not just closing disparity gaps, but giving all of us a chance to maximize health and well-being so we can have healthy, strong communities. Making sure that there is a distribution of medical resources that is fair, right? Recognizing that we can't achieve health equity and maximize health without making sure that the distribution is fair. And health equity is more of an outcome of that fair distribution. Minimizing financial hardship for individuals and families from medical costs. This is something we thought about a lot. I know that many of us are probably here because we've seen some of the impacts of our current healthcare system on folks financially, both in terms of health and in terms of finances. So this was something that we very specifically focused on. And then looking at a community sense of ownership and governance for whatever plan comes out of this recommendation. And I think when we think about the community sense of ownership and governance, that is a piece in my mind, that connects most directly to the work of this committee, right? We can't have a sense of ownership and governance of something we've never heard of, first of all, so communication. And then we can't have a sense of ownership over something that we haven't helped to shape and that doesn't feel relevant to our lives. So that's that engagement, that two-way communication, the listening that this work group is tasked with designing ways of doing. And then also, finally, we can't have a sense of ownership and governance over something that we feel like is not happening in a way that is ethical and transparent. So again, back to those rules that we were just talking about that govern our work and help us live into these principles. Do folks have any questions about these principles and how they might relate to our work together? And maybe we can, thank you. Move to the next slide. Are they clear? Do they make sense? Seeing some head nods. And I hope that if it is not clear to you, that you will speak up, because usually, and I know this bears repeating, it's kind of a truism, but if you have a question, you're probably not the only one that has the question, and you will always feel like you're the only one that has the question, and you never are. So just want to say that. Please ask the question for all of our benefit, if it comes to mind for you. And then, feel free to respond to any of these. What are some of the ways that you see that this work in our committee can advance these values and principles that were adopted by the board? And are there any procedures that you think we need that we don't currently have to ensure that these values and principles are the outcome of our work together? So just open the floor to anyone. Feel free to raise your hand if you have any thoughts along these lines. I'm just going to create a moment for people to process and maybe respond before moving.
Would it be helpful to see the previous slide again for anyone, or? Yeah, okay.
Thank you,
Katie,
Amy.
can you go back?
Yeah,
Colin?
Colin, please.
Yeah, just on the risk of, like, I don't know, talking too much, but it seems like there's pretty good responsivity with Katie. Like, just every time I email that or I reach out, it's pretty quick to get a response from the team. And my sort of thought is that I think there's a chance somewhere along the line there's going to be an angry Oregonian, like somebody who doesn't understand what it's so confusing. Someone who doesn't understand maybe what we're doing or the context of it. Is what's the best resource for us to give to somebody we're chatting with who's like maybe so frustrated they want to talk to a human? Is Katie the best person to share that with? I don't think we have like a hotline. Just sort of this, maybe somebody who doesn't believe these 5 principles are part of what we're doing. What's our course of action if someone wants to talk to us?
So thank you so much for that question, Colin. And I will say, before our board was even convened, we did start receiving emails from people who were experiencing frustration, even at the idea that a plan for universal care could be created by the state. So that's definitely true. I do want to gently invite us all to consider that it's not always because they don't understand what we're doing. There are unfortunately people who just see it differently, right? And that's part of diversity. So sometimes people don't understand. Sometimes people are opposed to what we're doing based on their own understanding of a different set of principles and values. So want to make room for that as well. I don't, when I read Senate Bill 1089, and, I think about my role as a board member, in other roles, I am an advocate. As a board member, I see it as I see it as a very serious responsibility to listen to all Oregonians, whether they agree or not. And I don't see it as my job to tell them why they're wrong. I do think we need to be transparent and provide information in plain language that's accessible so people can understand what we're doing. And I'm happy to, I think that information is provided when people write in with questions or concerns about their understanding of our work. And I also think that part of our job is to understand what people's concerns are. And that is part of plan design. That is part of this work. So I would say that's my slight reframe is we want to hear from everyone, whether they support our work or don't support our work. If there's questions people have, I think that that where those questions can go is a great question. But I don't think that our job is to convince people of one thing or another, because we don't even know what the plan design looks like specifically yet. That is the work we are all engaging with, and Oregonians are going to be part of that work as well. So I would say first and foremost, if people are emailing us with frustration, that's great. I want to hear from those people. Those are the hardest people to hear from, right? Because it's less motivating perhaps for them to communicate with us. And I want to understand what those concerns and frustrations are and wrestle with those tensions here. And so I'm really glad that you're bringing that forward. I do want to get back to your question of like, where do people go if they have specific questions? And I think that's one of the things that we'll have to talk about here as well. The last thing I'll mention before I go to the hands I'm seeing, which I'm really excited about, there are some resources in English and in Spanish on the website right now, including some summary work that the task force did. So I just want to make sure folks are aware that those resources exist. I'm not saying that a government website is the most accessible way to get information out or that it's all plain language, but it's a starting point. And I would love to go to, on my screen, I've got Amy and then Mickey.
I think Mickey's hand was up first. So.
Okay, thanks. Go ahead, Mickey.
Oh, I was just gonna second Vice Chair Glass's comments here. And then the second thing is I would recommend public comments during the board meetings, because I think that would be a great opportunity for the full board to hear what the concerns are and to be able to address those. It's really great to have diverse perspectives because we don't know everything. Each individual brings a lot of great things to the table, and sometimes we might not agree, but we could agree to disagree. And there's going to be folks that are going to have some perspectives that we didn't think about, brilliant ideas we didn't think about, and it might not be something that we don't initially agree with. But anyway, and then I'm looking at this and I'm pulling up, I was going to ask if this was on the agenda so I could follow along and go back and forth between slides, and I see that it is. So that was the other question I had. Thank you.
Thanks so much, Mickey. And that did make me, I just made a note. One thing that we could do as a communications committee is do a bilingual plain language guide on how to give public testimony, because I think just telling people to give public testimony might not be helpful for a lot of folks. It's kind of an inaccessible, wonky system. So that's one next step I could see from this conversation. Amy?
Yeah, and I just wanted to make sure that Mickey knew that both at our board meeting and all of our committee meetings, there is an opportunity for public comment, and then people always can also do written comment if they aren't into speaking publicly. But Colin's comment made me think, and I kind of was looking at the website. It may be something, and I don't know if it's the work of this committee or whatever, but like kind of a FAQ type thing about this work that's easy to digest in like a 1 or 2 pager might be something that we want to look at doing, because the website is great and has a lot of detail, but I don't know if people think that would be helpful for something for us to work on.
Thanks, Amy. I did make a note on that, and then I see Mickey and then Grace.
I was just going to follow up that's brilliant, is to have some guidelines that says, kind of some guidelines on how you could provide public comments. So it's not just a venting session. And I do work in local government, and we do create those guidelines, and we say it beforehand, and we say, this is your opportunity to talk about business matters, and it has to be specific, and here's how much time you have, and you have to be respectful, and you have to address the whole body and not target one over the other. So another here. Thanks.
I hear a wealth of lived experience in what you just said, Mickey. Thank you for that. Yeah, I really like the fact that you're also reminding me that we don't have to reinvent the wheel. There are a lot of guides out there that can help people navigate that process if it's unfamiliar. So appreciate that. Grace?
Yeah, I just wanted to give some comment about what Amy had to say, and I really, really agree that we should have a one-pager, you know, that we all agree on, that's easy to focus on with messaging and makes it concise and easy for people to understand. Because as stated before, there is a wealth of information, but not everyone has enough time to sort through those, and that's kind of our job. And I'm a huge advocate for plain language and have taken the training, so I think that's an important part of keeping people engaged, is making sure that when they look at it, they don't just see paragraphs, they see something that they could relate to in each bullet point. So just wanted to second that.
Awesome. Thanks so much, Grace. And really glad we have trained plain language advocates on this committee. That is such an important piece of this work. Other thoughts around values and principles and how we might put them into action? And then your question, Colin, about what we do when somebody has a question about our work, I think is a really great question. Clearly, if a frequently asked questions or FAQ document is not going to meet the need for everyone. I don't know that we have a human that we can volunteer in this moment. I'm wondering if that's something we can take back and think about and maybe even bring to the board, or yeah, just maybe report back on. It's something I've noted. I don't have a quick answer. Does staff have any thoughts?
At present, most of those types of emails, like public comment, come in through the dedicated email address that's posted with each meeting, and those go directly to Katie. And like Michelle said, we don't have a person who is specifically dedicated only to responding to public comment or taking phone calls. I don't think there's a number that could be used. At this point, all of the information comes into Katie, and Katie sort of separates it out to where it needs to go, whether it's public comment to the board or to one of the committees. And, you know, as Michelle said, we've received public comment or inquiries that were critical of the work or wanting to know more about what the board would be doing or what they think about different topics. And those all come into that same email address. But if the committee wanted to think through and talk about or recommend any sort of other response mechanism, you all can certainly do that. But I just want to make clear, for the purposes of what we have now, the info email that is posted with every meeting is the best way to send in public comment.
Thank you, Jenny. I think there's also there's room for multiple roles. Unfortunately, because of public meeting law and in trying to be as transparent as possible, we are a little more constrained as a board and as committees under the board's policies than outside advocacy groups. And I think that there's a real opportunity for multiple ways of doing this work. My experience is that when I am in my advocacy roles, I am most flexible and able to be much more responsive a lot of times. When I'm in roles like this one, if I were to get on the phone with everyone who had a question, that wouldn't be transparent to everyone else. And so some people would be getting more information and more access and giving more input than others, right? So that's not ethical for me to do as a board member. So I think also there's a way to creatively work in there's roles outside of this board. And so I think there's also something I want to do is make sure we're providing information to groups who want to do that work that we can't do, that goes beyond what we can do in a way that's transparent and accessible to everyone in an equitable manner, if that makes sense. And back to Mickey.
I'm so sorry. I was looking for the slide deck so I could go to the next question without removing this from the screen. And I'm having a hard time finding it on our agenda. If somebody could email me the slide deck, that would be great, or a
We can
link.
move it forward, I think, Katie.
It's also on the website. If you look at the meeting materials for this meeting and you scroll down, it is called, I was just looking at it. So if you go to the Universal Health Plan Governance Board website, and you click on meetings, let's see. our committee has a specific page. If you go to 2024 meetings and materials, and then on the sidebar menu, you click on committees. Then you can see communications and community engagement listed.
Yeah, I'm on the agenda, and if I click on the materials like 3.1 or 4.1, it gives me a document with text as opposed to the presentation slides
Yes, so the meeting presentation's on the website.
on the website. Okay, got it.
And
And
then
then
presentation.
oh, sorry. Okay, thank you. And then an idea for all the comments where if there's an abundance of them, maybe collect them and categorize them by themes. And if there's a massive amount of like, here's a theme for this one particular one, we've got like 30 public comments for this, and it's this theme. So maybe it could be addressed by staff level, or it could be what do you call it? Elevated to the board level, or even delegated to the subcommittee or the committees if needed. So that's one idea as well. Because again, being in local government, we get like hundreds of complaints every day. And then we, pile them by themes and priorities, and also what's, within our scope and that sort of thing. We triage it. Thank you.
I love that suggestion. And Mickey, did you have your hand up again, or is it still up?
Sorry, it was just still up. I'll take it down.
No
There we
worries.
go.
Didn't want to miss anything. Yes, so that's a great suggestion. So what I have so far for this conversation is we would like to, and please, what I'm going to do for the purpose of time is state these as a proposed recommendation. And then y'all please let me know if you disagree or if I missed anything. So I heard we want to guide on providing public comment to the board or to the committees to let people know that opportunity exists and how to participate in it. And we want that in plain language and in English and in Spanish. We want to have a plain language, fairly short, frequently asked questions document and or one pager that can be easily shared, that's more accessible than anything we currently have. And we would like to recommend to the board that public comment be scanned for themes, and that those themes be shared out to the board and relevant committees on a regular basis. Did I capture everything? And is there anything that you all disagree with if we were to take those recommendations back to the board? Colin.
Is it possible to also include that plain language in other languages besides English and Spanish, or maybe by request, or whatever the best way to do that is?
Yes, absolutely. I would have to defer to staff. I know for these meetings, they are translated into English and Spanish, but yes, I think that's a great recommendation. And we can think about what resources that entails and what we have for that. Thank you. Grace.
This is not a disagreement or anything, just more of a, I was thinking that for the one pager, or in my head, is more like a one pager of information that discusses like the values and principles that the board is guided by for community engagement and communications, and then separately like a one pager for frequently asked questions. So like 2 documents, and then the frequently asked questions can be updated as needed, and then assuming that the information one will just stay the same. So it can be like on a live document like Canva, and it can always just be adjusted or tweaked just a little bit, so it's easier like administratively.
Thank you, Grace, for those excellent additions. Yes. And actually, speaking of public comment, we got some really helpful public comment from Tom Sinsick when we were doing the values and principles work, that provided us a framework for what could be more a public facing version of our values and principles than what we use internally. So I think next month y'all are previewing a little bit of the work, but all of this can go into a contract that we are working on to get some help with communications work to put some of these materials together. So this is so timely and helpful. Mickey.
Oh, and what do you guys think about talking points? Giving the committees talking points in case they're being requested to speak about this, or they're being requested to, where do we go for public comments and that sort of thing. So we as commissioners are united with our messaging. I mean, not commissioners, committee members are united and not misspeaking. And who would create the talking points?
So those actually exist for board members on a monthly basis, and they're kind of updates so that we can share out consistently what's been happening at the board level. So we can certainly, Amy and I and staff can bring it to the board as a recommendation that those monthly talking points and updates be shared with committee members as well, knowing that you all are also faces of this work in some ways, and a resource that folks might be going to with questions. So let me
Thank you.
bring that back. And I know that we are over time for this agenda item, but I'm so excited about how much input we've received from all of you today, and I'm so grateful. So thanks so much for leaning in and sharing all of those great thoughts and brainstorm. I've taken a bunch of notes and I am going to pass it to staff, and my apologies for running over. But again, just really excited about the energy. Thanks, y'all.
That was fantastic. I just want to check, Mickey, your hand is up. Did you want to say something else, or is it left over? Thank you, Mickey. Okay, and really, Michelle, it's kind of great that so much time went into that, because that was going to be part of the conversation we had after we looked at the resources that were sent in. And so this is such an amazing group, and really all of the input is so wonderful to hear, and all of the activity is so useful. So I'm going to ask Katie to put up really quickly, and I think we can take care of this before break. Put up really quickly the spreadsheet that I put together of all of the resources that were sent in by committee members. And so we got a lot of responses, and Amy had put together a spreadsheet way before we had even started talking about it. And she shared that with me with some of the organizations that she had already identified. And so the way that it was framed when I got that spreadsheet from her, organized the different entities by what their concentration area was, or what their topic area was. And so I kind of kept it in that format, because we talked about regional, separating it by region, but the regions are often identified explicitly within the name. And so this was sent out as part of your materials, and it's posted. And really what I'm hoping that everyone can do is just take a look at the spreadsheet, take a look at the organizations who have been included here, and see if there's any information that you can add, whether it's more organizations that you feel like may be missing, if there are specific groups that you think have been left out of the resources that we've put together here, or if you have further information about some of these organizations, maybe a contact person or a good email for them. I went through and made sure that we had a website for all of them, so the committee members would be able to take a look at what the organization is if you're unfamiliar with it. But if you have additional information about a group or a contact at any of these groups, it would be really helpful for us to start compiling that. Because as Diana comes on, and as we have work from our in-house communications group, and we look at contracting for additional help, this is some of the forward-looking work that we can put together now, so that we won't be doing it then, and they can start incorporating all of these groups that the committee has identified as organizations that the committee wants to ensure that we're keeping up to date on what the work of the board and the committee is. And so right now, as the committees are getting started in all of the different subject areas, we don't have a lot of information that we would be pushing out. So it's a great time for us to start to look at, who do we want to be engaging with? Are there entities that are missing from that engagement? And how can we ensure that we're really trying to keep creating a really good sort of resource list of who we want to make sure that we're getting the information out to as we put together that communications plan? Because you've all just created so much information that we would want to ensure that we're sharing. And of course, we would be keeping it on our website, but as we've talked about, it's not always the easiest for people to find their way to government websites. So who do we want to be pushing information out to? Because all of the information that we've created, like we could be pushing that out to different organizations to say, please connect with the UHPGB. Let's drive more public engagement, because I think what you were saying about, local entities getting a lot of public comment, we're getting we're getting public input, but it's often the same individuals who are providing input. And we want to make sure that we're getting our information and the work of the board out as far as possible, so that more people are engaging with the board and asking questions and giving feedback on what we're doing. And so the more that we can push out information to a lot of different groups, the more helpful it's going to be in terms of making sure that we're hearing from more voices. And so, Mickey, go ahead.
I just want to apologize. I haven't sent you my list. I do have a list for you from Central Oregon, especially, so that we'll have more to add to this. Thank you.
That's great. And it's not a static document. It's definitely something that over the course of our work, we're still going to want to be adding to all the time as we identify different groups or we're made aware of different groups. Michelle, go ahead.
And I just want to state for the public record, for any community members who might be listening now or in the future, that this is in addition to anyone who opts in on our website. So this is not like, we will also be sending information to everyone who can, anyone who wants information or wants to be on this list can opt in on our website. But we're also trying to think of, there are lots of constituencies that will be impacted by this that may not know about our website yet or know about our work yet. And so we want to make sure that we're also being proactive and expanding beyond the people who opt in. So just want to say that it's a yes and not that this is an exclusive group that we're going to decide who gets this information, that anyone can go to our website and sign up for updates, in addition to making sure we're getting information to a whole host of diverse organizations that serve Oregonians.
Thanks, Michelle. Amy?
I'm sure it's there somewhere, but I just want to make sure that we have like all of the regional health equity coalitions captured. And Michelle's a good resource for that, but that's a good way to get information to diverse groups throughout the state. And then when we were talking, like one thought that I had, like for future things, like once we kind of have languages, we could, as we engage with different groups, like if we have a blurb, to ask them to put in their newsletters, is like one idea. Or if they have a health committee, like, at some point when we have set things we want to present, or we're asking for things, like getting on agendas, that kind of thing.
Yeah, I just wanted to add to what Amy had to say. I really see that as something that, as a part of the plan, that would be really useful, is reaching out to communicators at the state who do send out those newsletters out to big agencies like DAS or OHA, and that's how I hear about a lot of information. And I think, yeah, using them as the first, get a whole spew and a network of people to follow along. And I think I could help along with that. I think I have some connections to the community engagement group happening at the state, where it's all state communicators that I can share information with. So it'll be a lot easier to just send it out and be like, if you want to give information or if you want to include this in your newsletter, please do.
That's really great. Jensina?
Yeah, I see that we're pushing a lot of information or enabling ourselves to push out information, but I want to make sure that we're positioned to poll as well. And the example of that I'm thinking of is the Lane County Commissioners meeting that Amy and Jay and I, even though we live here and we're on this particular committee, we didn't even know that this was happening, that they were going to be discussing the resolution. We received an email from the Healthcare for All folks actually mentioning that it was going to be on the docket. And so I want to make sure that we make room for communications to come to us of opportunities where we can engage, because otherwise, if we're just talking about how much we can talk to everybody else and not necessarily being open to the to other opportunities that are not necessarily on our list. And I don't know if that means that we as a committee need to sign up for every single newsletter known to man in the entire state, because it certainly feels like that sometimes. But I also just want to make sure that we are not limiting ourselves to where we think we can push information.
Thanks, Jensina. That's a great point. And Katie?
I just, the private sector, any representation from the private sector is lacking from this list. And I think it's important to make sure that we engage the private sector, especially if they're part of the funding conversation.
That's great, Katie. And if there's anyone that you would recommend where we would start like pulling in those different organizations?
Yeah, I have a few ideas and I can pass that along.
That would be great. Thank you. Michelle, go ahead.
I was just going to say thank you so much, Katie. That's why we were so excited that you applied. And when we were reviewing applications, I think that this list probably is representative of like a lot of the perspectives on this group. And so really, really appreciative of any contacts or organizations that you can share with us. I'm just really grateful for your perspective and for you bringing it forward, and looking forward to engaging with the folks that you recommend.
And Colin?
Yeah, thanks for compiling this list. I haven't offered any connections in it, but I'm glad to see it growing. Since this is like one of our ways that we're giving information, we could include universities or community colleges or other places where there's people like learning about healthcare, you know, because they're going to eventually work for these organizations. Yeah, that kind of thing.
Thank you. That's great. Okay, we have about 1 minute before we're going to go ahead and take our break. Is there any other recommendations about different organizations or topics that anybody wants to put forward? John, go ahead.
Just to add to Colin's point, it sounds like even as this conversation was unfolding just over the past few minutes, I'm in the same boat as Colin, I believe, in not having submitted something for inclusion. And so I just want to make sure if we can still, you know, in the days ahead, still email maybe some compilation of other additional ideas, thoughts, and recommendations for this list and kind of strategy. We're still in a good place to send those after today's meeting as well.
Absolutely. Anytime.
Okay.
Really, there's no closing date for this resource list. This is something I think we should be compiling as long as we're running and working as a committee. Thanks, John. Grace?
One of the perspectives that I did want to bring, which I actually even forgot to include, so bad on me, but I'm working on a community justice focus group, and we're talking about reentry services for justice involved individuals, and just that connection between Medicaid and leaving the system, and kind of how there is that disconnect in services. And so something that I wanted to bring up here was that reentry services point, and working with justice involved individuals to see those gaps in service.
Thanks, Grace. That's a good point. And Jocelyn?
Another demographic that I was thinking of, I've talked to some administrators who have had concerns. I was just wondering how we could address those. I know with a single payer system, that would take a lot of the administrative burden off, but I know a lot of people who work in administrative positions or billing, they're scared that's going to impact their job. So I think that's something else that we should think about addressing.
Health system administrators specifically.
Yeah.
Mm-hmm.
That's a great point. And one thing I do just want to make sure is clear is that SB 1089 doesn't direct us specifically to adopt and only look at plan design for a single payer system. So I do just want to be clear about that point. It is well within the realm of possibility. It is not a decision that's been made or adopted by the legislature. So I think that's one thing that I try to be clear with folks about. And we still want to hear those concerns. So I think it's a great point.
And I will also say that the bill and our committee's charge does include specific outreach to employees of current health systems. And so looking at reaching out specifically to administrators is something that the committee is required to do. But yes, I will also add them to the list because I think that's great that we would be pushing out information to them all the time. Okay, we're a little bit over for the break. We can break now and come back at 1:17, and we will be hearing from Grace, actually a committee member, about the Oregon Advocacy Commission's work on House Bill 4052. And so everybody have a good break, and we'll see you at 1:17. Thanks.
Thanks everyone for your patience. We're going to be getting started in just a few moments.
Okay, everyone, thank you and welcome back. We are joined today by our committee member, Grace Hokog, who is going to put on her Oregon Advocacy Commission hat and give us a presentation about the work that they have done around House Bill 4052 and the engagement and outreach and feedback that they've gotten doing that work. So Grace, please take it away.
Thank you so much, and I'd absolutely love to invite my team who is here in the room. So Micah and Kai, love to roll it out in this wave 3. We call ourselves the Mighty 3 since we're a small agency, but we are hopefully looking to carry forward a lot of important work. So I would love for my team to introduce themselves.
Hi, everyone. My name is Micah. I use she, her pronouns, and I'm the health equity team lead here at the Oregon Advocacy Commission's office. I'll go ahead and pass it off to you, Kai.
Hello, everyone. My name is Kai Jensen. I use they, them pronouns, and I am the other Grace. I'm a project facilitator here on the health equity team.
And I'll just introduce myself again. Grace Hokog, she, her pronouns, and project facilitator for this work. So super excited that you all invited us here today and just to be in community with you and to understand this work because there's so many recommendations that, this committee could really take on. So I'll go ahead and pass it back to Micah.
Alrighty, so I'm just gonna go ahead and kick us off and give you all a little bit of background into what the heck our agency does, what this bill is called House Bill 4052, and all the things. So today, hopefully, again, I'll be sharing some background with you around the House bill, also our team. We're gonna identify some areas of overlap between our work and y'all's work. I've already touched base with folks that are at the Universal Health Plan Governance Board a few times, and it does sound like there's quite a bit of overlap in our work. So I'm really excited to dive into that. And then hopefully we'll be able to build some connections along the way, continue having open dialogue about community engagement, our work, your work. So this will hopefully not be the last time that you see all of our faces. Next slide, please. Okay, so House Bill 4052 is split up into 2 agencies. So the bill not only touches our agency, which is the Oregon Advocacy Commission's office, but it also touches on the Oregon Health Authority. So Oregon Health Authority is in charge of the mobile health unit pilot programs that are currently underway. And then our agency also received funding through this bill where we were in charge of doing the community-led recommendations that were all focused around social determinants of health, really doing like a big piece of that community engagement lift. Our 2 teams don't really have too much overlap. We definitely are in constant communication, asking each other how the work is going, what's new, things like that. But our work is pretty separate in terms of like the body of work that we do. So I definitely wanted to mention that because I know that sometimes both of our teams at OHA and OACO both go by like the House Bill 4052 teams, so it can be a little confusing, but just wanted to make that distinction. Next slide, please. So our team, once the bill passed in 2022, declaring racism a public health crisis in the state of Oregon, our team set up 2 affinity group task forces. One was the Health Equity Advisory Leaders, otherwise known as the HEAL team. And then we also set up another affinity group task force, which is also called the IHEC or the Indigenous Health Equity Action Council. So the HEAL task force was mainly made up of general community members, mostly geared towards BIPOC community members. And then the second task force was specifically a safer space for the Indigenous population. And so what both of these task forces did was they came together on a regular cadence for about 18 months or so, discussing ways that we could alleviate racism in the state of Oregon. And they pretty much spiraled off ideas, thoughts, and just open conversations around that. And so when those two teams met, we ended up getting a very hefty list of well over 110 ideas and recommendations around how we as a community and as state government workers can do a better job around alleviating racism in our community and in the state. Next slide, please. So the biggest takeaway that I want everyone to be able to say, like, yes, the House Bill 4052 team presented to us today. The one thing I learned is that this is a very community-led process. Hopefully you won't forget that piece, because that's the piece that I try really hard to enunciate, especially. So this bill was passed because of community thought leaders, and because people really, really cared about this issue. It was really led by community-based organizations, service providers, coalitions, task forces, really just a wide range of human beings that care a lot about this issue, namely the Oregon Public Health Association, who did a huge chunk of the heavy lifting at the beginning of this process. We also met with tribal leaders, citizens, and communities, and as well as thought leaders who helped design House Bill 4052. And these are all just like very broad groups of folks, but we continuously work with a wide range of people every single day in this work. So these are really just like the big groups of folks that really helped get House Bill 4052 off the ground. Next slide, please. So we have a report. We just published our interim report. I keep saying just, but I realize I've been in this role for a year. So this report is like a year old now. We published our interim report last December, and it is a very, very chunky report. It's about 80 pages, but it is really cool being able to see like the whole thought process and timing of like how House Bill 4052 came to be, who were the folks in the room that were gathering these task forces, what were the issues that these task forces talked about, and it just gives you like a really in-depth deep dive of how House Bill 4052 was created and established, and what that first like 18-month process really looked like. So if anyone has the chance, I highly recommend giving it a look through. Our final report is due June 30th, 2026 to the legislature, and that'll be a culmination of the work that these three folks today with me are presenting on. So it's really about like, this final report is really going to be about like the implementation of House Bill 4052 versus the recommendation gathering that was a majority of the first 18 months of the bill. Next slide, please. So I've been talking about all of these recommendations that the task forces were able to give us. They really fall in these like major 6 buckets of broad topic areas. So they range from healthcare access and quality, education access and quality, social and community context, economic stability, neighborhood and built environment, and then government processes. The government processes one in particular is one that I really like to highlight, just because it's not necessarily seen as a social determinant of health bucket, but it is really important when we're talking about racist systems that are in place when it comes to statewide government. And there's still so much work to be done when it comes to like dismantling deeply rooted systemic issues that are currently existing in the state. So I always like to highlight government processes as one that all of us should be more familiar with. Next slide, please. So our process has been real busy, and we're actually kind of like in the thick of this process right now, which is really cool. So right now we've been identifying collaboration opportunities with other state agencies and legislators and community-based organizations. And then from there, we really get more refinement around these recommendations, more feedback from community. We've been doing focus groups, which I'm sure my team will talk a lot about later. And then from there, once we've refined these recommendations, we are implementing them. So right now we're in the thick of helping legislators draft legislative concepts on behalf of community and elevating these really important issues that community came to us with and making them a reality. So we'll be able to see quite a few of those come to play in the 2025 legislative session coming up. Next slide. And then we always put this piece and want to highlight this particular topic around tribal sovereignty. At the beginning of our team's work, it was really emphasized on us to be really mindful around tribal sovereignty and making sure that we are doing our part in not just writing folks that are indigenous or folks that are part of the tribes into bills that we're talking about with community. It's really important to go through the formal process of doing a tribal consultation and making sure that that population is well informed of the things that folks plan on writing them into bills about. This happens a lot. Unfortunately, in our state government, where we think we're doing the right thing by including folks that are part of tribes, when really the whole tribal consultation piece just kind of gets lost. So this is always something that we put in our slideshows and our presentations just to ensure that we are making sure that we are doing this piece when it comes to drafting legislative concepts and having those conversations with the right people. Next slide, please. Alrighty, so today we're going to be talking about some behavioral health recommendations with you all and how we sort of got all of our feedback from folks and did those community engagement pieces. So I will go ahead and pass it along to the next human.
That is me. I'm the next human. Yep, today we'll be talking about 3 recommendations in particular. Our team is prioritizing about 18 to 20 recommendations that we're seeking to implement in existing programs and also legislative concepts. And so the 3 that we are presenting today is screening for racial trauma, linguistically and culturally specific healthcare, and healthcare education and advocates. Next slide, please. So I just wanted to give some context for the reason why this is framed as a problem and solution is because, as Micah said, this was convened with community, and they were thinking about the idea of what would be necessary to create a legislative concept to move forward, our priorities. And so I just wanted to give that context. So this recommendation particularly calls for screening for racial trauma. So although racial discrimination can cause symptoms of lasting trauma, few tools for its measurement and collection exist at the state level. So this recommendation in particular focuses on behavioral health services which can very well be applied to other systems as a process improvement within existing programs. So for example, in this particular recommendation, when individuals first undergo an initial behavioral health assessment, the state is required to do an assessment within 90 days. And so the recommendation is to pull out one of the Oregon administrative rules for those assessments and implement a tool for screening for racial trauma, so we don't have to create a whole new program, but rather implement it into a process that already exists. And to me, a core part of the engagement of this recommendation is that this solution aims to meet people where they're at. And I feel like that's a really important part of this process and provide tools as early as possible rather than throwing them into a system that doesn't tailor to their needs. Next slide, please. Sorry, I think this one will be Kai, and then I'll be slide number 3.
Yeah, we can go to the second one. It's all right.
Okay.
So a recommendation that came from a number of community members was the need for linguistically and culturally specific healthcare services. So in addition to those groups that Micah talked about before, we met with some of the folks in our commissions as well to get some feedback. And the Oregon Commission for Hispanic Affairs, or OCHA, has a priority around language access that really intersects with this particular recommendation. So we are collaborating with that group as part of the community engagement and outreach, both as part of the process of developing these recommendations and as a partner in the process of figuring out how to implement changes and ensure at every step along the way that community is informed and not just informed, but an active participant in guiding that process, making sure that have ample time to check in and say, is this what you wanted? Does this seem like it is going to solve the problem in the way that you're hoping? So this particular problem is around the need for linguistically and culturally specific healthcare services. You can see the chart to the left shows some of the different languages that are spoken here in Oregon, as well as a comparison of how well they may speak English. And so you can see that there are different levels of need depending on the person's individual background. One of the things that community lifted up as a potential way to improve the situation for patients in areas where there aren't a large community of folks speaking that language, where we don't necessarily have a interpreter, is perhaps we could utilize virtual services to allow for video interpretation, for instance. Something like that could really change the experience and outcomes for patients who are often experiencing really important and life-altering situations in these contexts. And I just wanted to share one more thing before I pass it back to Grace. In addition to some of those avenues that I mentioned, another way that we're getting community feedback on these recommendations are also through focus groups that we've conducted with some community members who have expertise in this area. And so Micah's been running a group focused on some of these healthcare related topics, and we've gotten a lot of really valuable information that's directly shaping how we look at kind of solving this very complicated issue. And with that, I will pass it back to Grace.
Thank you. So for this last recommendation, it's all about healthcare education and advocates. So as you can see, the community quote is really based on their fear of navigating the system based on their identity and perhaps even pre-existing conditions. It says medical trauma, anxiety, neurodivergence. So I think this recommendation in particular speaks to identity-based barriers, so concerns about discrimination based on the way that they present, their ethnicity, or it creates a hesitation in seeking care. So kind of considering that when we're engaging with communities, as well as bringing up the historical context that medical trauma and past negative experiences can create lasting barriers to accessing healthcare. So just kind of tying it back to having an advocate there in person and being in that hospital setting will be able to make people feel a lot more comfortable that they are navigating their healthcare in the best way possible and to improve their health literacy in general. And lastly, just navigation complexity and just the resource awareness gap. So there's a disconnect between people finding those available services and the community knowledge of how to access them. And I think that our team really focuses on meeting community-based organizations where they're at, since that's where a lot of the services and a lot of communities trust uh, the community-based organizations, and they provide them resources when they're really in need. So being able to connect community-based organizations along with healthcare advocates with this resource awareness gap, I think is something that we could do moving forward. So I'll go ahead and pass it to Micah to wrap us up.
Thanks. Yeah, so another plug for the report. If you do have time to read it, please do. It's real cool. There's lots of cool stuff in there. We also have our Oregon Advocacy Commission's office website where we finally have like our webpage up and running on there, and there's some more resources there. Also feel free to contact me. I admittedly don't check that email below as often as I should, so I'm more than happy to provide you with my email in the chat or after this, and I can have someone on staff send it out. But yeah, thanks everyone for listening. I would love to invite anyone to ask any questions, give comments, any feedback, anything like that.
Thank you so much. All three of you. What a treat to get to hear from folks. Amy.
I want to make sure none of the committee members have questions before I ask. But this recommendation 2 slide that had the chart with the languages, I was curious what the source data was, and I was kind of trying to navigate reading it in terms of like what was the national data versus the Oregon data. It was a little bit confusing, but I thought that would, if you're able to share with the staff the source data, that could help inform kind of how we prioritize if we have limited, getting things in multiple languages, having a better understanding kind of what the need for interpretation and things to be transcribed is beyond Spanish.
Yeah, absolutely. We can get that for you and we will send it on over. Kai or Grace, do you know off the top of your heads where it
I
came
don't
from?
Yeah, I don't know if y'all will have access to the slide deck. There is a link. It's not the easiest to see, but there is a little link there below the chart. It's from the Statistical Atlas. And if you navigate to Oregon and then look at languages, that's where that information is from. I don't seem to have access to a chat to drop the link into, but
Unfortunately, we don't have a chat for this meeting, but yes, we can connect. This is Katie, a part of the staff, and so we'll connect after to make sure that everybody gets that information.
I just wanted to add something really quickly in terms of the top languages in Oregon. I believe we were shared a resource from FEMA, the Federal Emergency Management Association. I don't know what the A stands for, I'm sorry. But basically the top 15 languages used in Oregon. And I think that's a really useful resource, and it breaks down, it doesn't just say, it breaks it down into racially specific categories for language. And I also just wanted to add that Kai is an excellent data nerd, so I know that they will get that back to you. Something that our team prioritizes is using disaggregated data to show specifically in Oregon that there is that disparity that exists. And when we present to organizations and things like that, that's usually like one of the first things we lead with of this is a problem and this is proven, and here's how we can implement our solution into an ongoing process or existing process that hopefully will elevate, something that a community member had to say. So I just wanted to say that. And for this particular presentation, we tried to focus it on community engagement, but I just want to say that if anyone wants to reach out to us about any of the other recommendations we have on our trackers or anything, we're happy to provide that information as well, because we collect disaggregated data about our top 20 priorities. So we're happy to share any information about that. And then I see your hand, Colin.
Yeah, thanks. So you presented the interim report in December 2023, and I'm curious what the response has been in the last 11 months, like from if there's been any sort of action based on your recommendations, or if that is something that we could expect maybe in the long session, or what your take is on that.
Yeah, the interim report was really just like a baseline foundational report, just telling people, hey, this exists and this is what we've been doing. It was really like a gathering stage of the first 18 months. So you'll more so see like the implementation, like action side of things in our finalized report in 2026. But yes, to your comment about next session. So our team has been diligently working with several representative and senators' offices to draft some of these recommendations into legislative concepts. And so we are actually putting forth 15 of the recommendations on our very, very long list and putting them forward in the 2025 legislative session. So we'll be talking more about that in our report. But we also send out monthly / every couple month newsletters to folks that are on our listserv about the work. And so if you want to get on that, let us know. We're going to be definitely like updating that pretty regularly around like how our bills are tracking through session. So yeah, we can definitely add anyone on here that's interested in getting those updates. Mickey.
Hi.
Hi.
Long time no see. I was wondering, and this might be outside of your scope, but thought I'd ask anyways, because you guys seem to be just a wealth of knowledge. Do you have any information with regards to like accessibility for deaf and blind and neurodivergent?
Accessibility for like the legislative concepts, accessibility when it comes to like community engagement.
Yeah, would like it, right now we're doing like, oh, we want to interpret it, we want to have culturally specific language and folks in the room from whatever medical visits. So it could be in the legislative concept, or it could be when you're doing outreach or communication.
Yeah.
Any guidance on that or advice about that we could leverage
Yeah,
for here?
absolutely. So I'm gonna lean on Grace and Kai to touch on the pieces around like accessible materials and things like that for like our like external and internal comms, but we are putting forward a legislative concept that's around linguistically and culturally specific healthcare services. It's going to specifically address, there's lots of nuances when it comes to writing bills and things. You can't say specific populations, you can't say like certain words. So I think the bill is going to be more so titled around linguistically appropriate healthcare services right now. And so that bill, which obviously like we hope all of our bills that we're putting forward pass, but this one would in particular would be helping more folks that are not anchors get interpreters for their healthcare visits. It's also going to have requirements around language interpretation for accessible materials in healthcare settings. And it's really going to cover a lot of different stuff that community brought forward about accessibility in particularly like healthcare environments, having somebody go with them to their healthcare appointments that are native speakers of their languages and things like that. So I'm really excited about that particular bill. Representative Nelson is going to be the one that's pushing that forward in the House. And then Grace and Kai, if you either of you want to talk about like how we do like comms things, since you both are more so experts than me.
Yeah, or Kai, you can take it if you'd like.
I was going to say, I'm going to give a quick plug actually. Right now going on there is a Oregon State Data Equity Summit that is going to have all the materials posted to their website afterwards. And there was a panel yesterday about accessibility features that are already built into Microsoft programs and how you can utilize those. And it was just so phenomenal. It's going to do a better job than I can sum up. But like, I think that like at a very basic level, like we do things like having things set at a size 14 font instead of 11 or 12. We do things like making sure our color contrast is appropriate. And the other thing that I was going to say that just popped into my mind is if you have questions about visually impaired things, the Commission for the Blind is amazing. They did a team building exercise for our organization, and they're just so like lovely and welcoming, and there's such a wealth of information that I'm going to answer your question with some resources, and I'll try to make sure that we get those in the clickable links for you. And I'll pass it to Grace to plug in anything I haven't mentioned.
That was perfect and really what I was going to touch on. And I do have a link to those resources. For example, what Kai was talking about with contrast, and just making sure that it's accessible to people who can view a broad range of colors. For example, it's called SCORM compliance. And then also inclusive language. There's actually a long list of inclusive language that's created by the state. I found a state resource from community engagement committees as well as plain language standards, which we touched on earlier, size 14 fonts. Sending agendas ahead of time is a huge help to help people process what they're actually going to be talking about. And then I think that was about it. We are a pretty small agency, so resource-wise, it's pretty hard. So we try to do as much as we can in terms of already existing resources. What can we implement? And even tools like AI, for example, like those meeting generation of notes, it helps the administrative process happen a lot quicker. And so I just wanted to mention those. And I can send a link as well and follow up with stuff.
That'd be great.
Thank you so much.
Amy?
Yeah, I really appreciate Mickey's question and then bringing up kind of intersectionality, and just kind of wanted to hear more. I mean, you talked about it, but having to advocate for my child their entire life who is very intersectional, neurodivergent, and Black, I refer to it as racist ableism that they've experienced in all the systems. So I just want to make sure that your work is kind of looking at that, because if we look at who is most vulnerable for a lot of things, it's BIPOC folks with disabilities. So thank you.
Yeah, we have, I think the really cool thing about our agency is that every single one of us has something that makes us a little unique and special. And we all have like very varying ways of like the way that we learn, the way that we process information. And so that's actually been a really big thing that we have been focusing on. And Kai in particular has been like our education person. And so we've had numerous conversations with people at the Department of Education, as well as the Youth Development Oregon folks, to really talk about like accessibility in schools and how that really overlaps with a lot of the work that we're doing. So that's definitely like on our list, and it's definitely something that we're hoping to bring forward in session at some point, whether it's a legislative concept or it's an internal process improvement within like the actual state agency itself.
Okay, I'll connect with you offline on that, because I do a lot of advocacy around special education and the mental health trauma that it is causing and the push out. But I wanted to make sure that you guys are aware of the Oregon Self-Advocacy Coalition. It may be a good group for you to connect with. It's a group of self-advocates with intellectual and developmental disabilities.
Thank you.
And I just wanted to quickly name, for those of you who aren't the type to type in House Bill 4052 and go look at the bill language, that some of those intersections that you called out, Amy, around disability location, like in terms of ruralness, are specifically mentioned as kind of intersecting identities with those priority populations that we're familiar with. So it's baked in from the beginning, and something that I think we also have tried to really uplift by like in our focus groups, in the various ways that we collected the feedback that went into the initial kind of report. Has been a lot of priority on lived experiences versus necessarily having a job or a title that signals that you have the appropriate level of privilege to be in a space. And I think that also kind of helps to address some of the silos that can happen when we're having these conversations.
And I just wanted to add to what Kai had to say that, it is baked into our process as well. For example, we're running 3 focus groups, education, healthcare, and community justice, and each has 15 experts, and we're all taking their demographic information and trying to follow the standards of RealD SOGI data collection so that we can actually move forward with data that's helpful in the final report, and say that, this amount of people with lived experience, were able to directly contribute to this legislative concept or provide solutions at the state level. So I feel like it is baked into our process as well of making sure that they're actually in the room and not just a consideration or an extension of that voice that, that they're able to contribute directly. So I wanted to mention that since we're all doing our focus groups. Mine just wrapped up, so I'm very happy. But, I just wanted to mention that.
And then I just want to bring our attention to the questions on the screen. I think you all have addressed some of them, but just Michelle, you have your hand up.
Really appreciating this presentation and Q&A. Thanks, y'all. I did just want to mention, since I can't do it in the chat, that RealD and SOGI, for folks who might not be familiar, is race, ethnicity, language, and disability. And SOGI is sexual orientation and gender identity. And these are state standards that were implemented due to legislation in recent years to make sure that we are collecting data that can be disaggregated so that we can see disparities and then address them. So just wanted to mention that for anyone who doesn't spend their days on in-state meetings like some of us do. And then I just really appreciate, I mean, I think your top 3 recommendations that you're bringing forward are really helpful for us to consider. I think one question I have is there anything beyond those that you think could really inform our work? One of our starting principles is we want to honor feedback folks have already given, Oregonians have already given, and we want to build off of work that's already happening. So I think these are helpful insights. Is there anything else that you think could go directly into informing some of our work?
I think absolutely. And because we are so tied to the other committees, along the process, in terms of procedures, healthcare providers, and everything, it really touches on everything under the sun because people in Oregon experience racism at all intersections, or people of color, experience racism at all intersections. So I think that in terms of pulling forward recommendations for community engagement, absolutely yes. And also along the line, as different plans come back to us to edit, I think that will be an important part of that engagement or incorporating already existing feedback. But if my team has anything else for the recommendations, I'd love to hear.
Yeah, I think specifically talking about like anything else that we're working on, we're specifically pushing forward a bill that's around language access at the DMV that I think could be really helpful to your all's work. This like initiative was started well before our team had even started. So this is like a 2-year process. Basically what we've learned is that the DMV materials, such as like the driver's test, for example, is not culturally or linguistically specific. And folks that, are not from this country or are not primarily English speakers have a really tough time with a lot of the materials and the tests that come out of the DMV. And so one of the bills that we're pushing forward is to make those pieces at the DMV more accessible. I don't have specific draft language around that quite yet. Or I do, and I'm bogged with lots of legislative concept drafts, but the draft is coming along on behalf of Representative Nelson's office. A lot of the community that we worked with, particularly the Commission on Hispanic Affairs, and then a nonprofit organization called Next Door, are all the sort of like minds behind this bill. And so I would definitely keep your eyes out for that for the upcoming session, because I think there's been a lot of work done behind that could help inform this work.
Thank you, Micah. And I just wanted to, with the DMV, the reason why I feel like it's particularly relevant is because it's all about language translation, is that people who are reading in English are receiving materials at maybe a 5th to middle school level, but when it's translated in Spanish, it actually goes from middle school all the way up to high school. And so there's a lack of standardization that's happening at the DMV right now that does need to be elevated. And it's really hard for them, even after it's elevated, to have those standards for plain language. And in addition, it's people who speak Spanish don't only just speak Spanish, they speak other subdialects of like indigenous languages, and that's where a lot of the problems come as well. So I think just that standardization of language and plain languages is a huge topic, and I feel like it definitely relates. So I just wanted to add that.
I think to answer this a little bit more broadly and also get a little bit into a couple of the questions we maybe haven't touched on. So in addition to that big hefty report that we generated, we also have a spreadsheet version of all of the recommendations that we lovingly refer to as the recommendation tracker, maybe not so imaginatively. But we can share out a link to that document. The first page of it is kind of the short list, the couple dozen recommendations for a variety of reasons that we decided to really focus on in the short term. There's a kind of second page that has a little bit of information that was kind of our like first attempt at narrowing the list and kind of looking for the most the issues that had solutions that really specifically addressed racism as a core part of the problem. And that I think will give you a real, like, for those of you who are really curious. So each one of the titles of a recommendation links to a Google document. The Google document has all sorts of hyperlinks and information. Those documents were written in collaboration with community often. But they were also generated by the kind of prior iteration of our group. One of the ways that all of the information that was gathered from everywhere across the state was put into this big long document, and the prior iteration of our team went through and coded it, looking for themes, and the links to that data and the color coding and everything is actually all there. So for anybody who really wants to like see under the hood kind of what it looked like. All of that is like transparently publicly available, and is something that y'all could look to, because there's such a wealth of information. Because like you said, communities have been giving us feedback for forever about some of the issues, and so we've tried to really not have to make people repeat themselves over and over again, and to kind of hear what they've had to say and gather as many helpful resources together under that touch on that issue, kind of in that place. So just want to offer that as an additional resource.
Thank you. That sounds great.
Colin?
Kai, is that, you said that that spreadsheet is in the titles on your interim report? Is that what you just said?
Oh, so the titles in the interim report do link to those individual recommendations and have all of that information, but we have a spreadsheet that kind of so you don't have to sift through the entire report to locate those, and you can sift it by different things and filter it, and we'll make sure to get that shared out to y'all.
I was gonna say I can share my screen really quickly if the group would like to see, because I think that visual information is helpful. Okay, let me share my screen. So this is the tracker that Kai's talking about. Sorry, oh, here it is. Let me move this over. So these are our priorities right now, so I can let you know by color. So red is all about education, and just so you know, these are directly what we're receiving feedback on for our focus group. So they'll be refining solutions. So red is all about education, green is all about healthcare access, gold is kind of miscellaneous, so kind of finding homes where they're already existing in places at the state. So for example, language access and equity that's already exists at the DMV. It's just a process improvement. Blue is all about community justice. Orange is all about child welfare, which was elevated directly by a community-based organization. She brought forward these legislative concepts, and she's really great at writing policy, so we elevated what she had to say. And then these teal ones we haven't touched as much. These are focused on Indigenous and tribal nations. So we wanted to make sure to be in compliance when just building these recommendations. So we haven't touched on those particularly, but we will absolutely share this tracker. And just wanted to say that this is public information. This is a public tool. Just kind of like as we were talking about with our own community engagement committee, we have an Excel tracker now of CBOs. This is almost a similar thing. And we welcome comments. We welcome, you should add this, make sure to not forget this perspective. And so I just wanted to say that it's always iterative, and, it's our job to filter and look through what people have to say, whether it's online or in person. So just wanted to mention that.
Grace, will you, while you're screen sharing, will you go to the third tab, the recommendations phase 1 for just a minute?
Yes.
I just want to point out, so if you look at the top here, in this column, it says, don't see your idea represented. Here's how you can add one. There's actually a link there to the presentation that literally walks community members through, and y'all, through the step-by-step process of how they can add, or you could add a recommendation. But I wanted to highlight that both for like part of that showing you under the hood, but also I think it's a really good example of a way that community members who maybe don't feel comfortable or for whatever access reasons like aren't going to speak up in a meeting like this, there are, like, we've kind of baked in asynchronous ways that people can get as engaged as they want to and have as much ownership over these concepts as they feel confident to have.
Yeah, and I was going to say this recommendations for phase 1 is all about what does the community believe we should implement in Oregon, which touches on all of the committees that we work with here at the Universal Health Plan Governance Board. And in particular, the short list was created because these are racially specific or population specific recommendations. So just trying to create that, focus and narrowing down. So this would be if you want to know what we're doing now, and recommendations for phase 1 would be what have we collected in total from 2022 to now, And I'll stop sharing my screen.
Thank you so much. I really appreciate that additional resource, which I think can be really easily incorporated into our process as a data input. And we definitely want to honor all of that feedback that community has shared in trust, and all the hard work that y'all have done to create spaces where people can share that feedback. So great start to get us thinking, and to start putting our work plan into practice of honoring and looking for and scanning for and incorporating feedback that's already been shared. So much appreciation. Yeah, Grace.
Thank you so much. And I know we're at the tail end of the presentation, but I really did want to offer this as I thought it was valuable. It touches on both what were OACO's engagement strategies and what can the committee learn from this work in particular. And Micah kind of presented on this earlier, is that when we were collecting this feedback, initially there were two groups, the Indigenous Health Equity Action Council and then also the Equity Action Group. And so the Equity Action Group was run by the OACO with staff led and staff present for notes. And we also heard the need that Indigenous people didn't necessarily feel comfortable giving solutions in such a big group such as that. And they wanted it to be more private and led by someone who was Indigenous. So this is an example of what we can model, is that we don't necessarily have to be a part of every single space, but we can help to fund and pay people for their lived experiences. I know the scan should be first, in my opinion, of already existing things, but that I think that, recognizing that you don't necessarily have to be in the room to receive feedback from people, and that can apply to community-based organizations. And it just has to do with comfort and power dynamics. And I think that's a really important part of this work, is there's always places to gather feedback, and making sure that we're using people as platforms for the people that they actually engage with on a daily basis. So I just wanted to offer that as like my last note.
Thanks for that insight and principle to guide our work. Appreciate it. Well, that was so much rich content. So just a reminder, if folks want to go back and digest more of this, or if you're someone who wants to spend some time processing it, the slides are posted on our committee website. So you can go back and revisit it and click all the links. And we really look forward to adding that report and that spreadsheet to our committee resources. Thanks so much. So that brings us into reflections and discussion about what else you would like to hear about, what other presentations or trainings or resources would be helpful in your role as a member of this committee. So really opening it up and inviting folks to reflect on what was useful from today's meeting. Who else you think would be good presenters to invite, and what topics or subject areas you would like some resources to learn a little bit more in order to fully support your participation on this committee. So would love to open it up for any of those prompts.
I'll raise my hand. Oh, there you go. You go, Colin.
No, you go first. I don't want to go first.
Oh, I was just gonna say maybe invite somebody from who has experience with community outreach to Indigenous people, somebody with that expertise. I kind of have somebody in mind, but do we have the ability to give them a stipend of some sort for being a speaker and sharing their expertise?
Mickey,
So yeah, please, Steph.
I can look into it. Our legislation is kind of specific about how we use our funding, but I can look into it and ask our executive director to weigh in and see if we have any flexibility there.
Great, thank you so much.
Colin.
Yeah, I have two thoughts sort of off the top of my head. One that I've been kind of like thinking about for a few months, and one that a friend brought up yesterday. Yes, I'll do the yesterday one first. I almost got into not like a real fight, but I was arguing with a friend who was telling me that Hawaii had universal health care. And I was like, what are you talking about? And so then I did a little bit of research about they have a near universal healthcare program. And I bet there's been some work with the Joint Task Force, back between 2019 and 2022. But I know that Hawaii is near universal. I've heard a lot about Massachusetts and Delaware. And I don't know if there's any easy to find experts from those other states that maybe could talk to us or talk to the governance board. So that's one idea, and I'm really curious the response to that. And maybe I'll save my second question for after.
Well, you are in luck, Colin. We have an excellent resource here in the room in Jenny Donovan, who did a scan of other states and what has been implemented and proposed that was presented to the full board. So I don't know if you want to respond to that directly, Jenny.
Sure.
Yeah, maybe the video from that board meeting.
So yeah, I think we could post which meeting. I think it was the August meeting that I did. It may have been earlier, but we can definitely send out information about which board meeting that presentation was in. Also, the presentation is still available within the slides from the board meeting. And again, I can't remember. I did so many presentations. I can't remember which one it was, but we can send out the slides and the presentation from that, or at least send you to where it is on the website. I did not include Hawaii in that presentation, the comparative state presentations or the comparative country presentation that I gave. But I think looking into Hawaii and seeing what is going on there, certainly we're looking into all of the different states and the work that they've been doing and connecting with some of the West Coast states in terms of the work they're doing. But I wanted to ask Colin, in terms of for the community engagement committee, are you thinking like maybe reaching out to them to see how they got feedback and information from the community in their states, or from maybe the institutions, the providers, and the health organizations and insurance companies?
I think that's a good way to interpret what I'm asking. And I do remember your presentation, right? So I appreciate the reminder that already existed, and I did watch it in real time. Yeah, like we just don't want to reinvent the wheel. So I bet somebody in Hawaii would be glad to give their 2 cents, or any state, to us specifically about reaching out to our community. And that leads into my other topic, which I've sort of been thinking about for a while, which I think it'd be really fun personally, and I bet other of us maybe would think it's interesting to go and informally talk to smaller communities around the state. I'm pretty right now flexible with my schedule, and so like thinking about that seems like reasonable and possible, in addition to any like official capacity of our in-person events or whatever, but I think more is more as far as like small group communication. And so yeah, that's something I'm interested in talking about.
Certainly, we'd love to learn from any activities that y'all do outside of your role officially representing this committee, and or with other organizations you might be affiliated with. So thank you so much for any of that work that's happening or that will happen. And we just really look forward to learning from it. So yeah, absolutely. Just making sure that it's clear in those meetings, if you are a board member or a committee member, who you are not representing in that space is always just like the only thing that we ask, and then just a report back so we can learn. So awesome. Thanks, Colin. John.
This might be a little bit of an offshoot of Colin's comment, but one element of the conversation earlier that really, I guess, caught my eye or caught my ear, I guess you could say, is the conversation I think that Amy started and involved other committee members in relation to speaking at the Lane County Board of Commissioners. And so the question that has stuck with me, or that has been forming in my mind, since we last met, was, this committee's role, and I guess the board itself role in sort of, I guess, and I don't want to use this word because it's probably not the right way to think about it, but informing or lobbying or being present at for local government, for state legislators. Are there things that is it appropriate for this committee and the board to sort of be thinking about cultivating knowledge and establishing two-way communication with those kind of stakeholders? Again, talking about local government, county commissioners, Oregon League of Cities, Association of Oregon Counties, those kinds of organizations, including up to and including state legislators.
It's a great question. I think when it comes to state legislators specifically, that's our boss. That's who has asked for this work to be done, and that's who we're reporting to. And our first interim report will actually be, as a board, will be presented in next month to the state legislature. So I think it might get a little muddy if we start side conversations with state legislators in addition within our roles as committee members or board members, because that is like kind of the overarching structure of this work. But when it comes to engaging local governments, local governments are employers, local governments are, there's lots of different connections that boards of commissions or city councils or city administrators or the League of Cities or counties might be interested in this work and how it would impact their operations and improve the lives of their workers and community members, or challenges they see, or what have you. So I think that is a great suggestion for engagement for the list that we were compiling, some of those associations, and something I hadn't thought of. So I really appreciate that. Thanks, John. Amy.
Yeah, I appreciate that, John. And so staff, I think maybe with the minutes, I'm not sure, we'll send kind of that email that has the recording of the Lane County conversation about that, and then the actual written resolution. And then it also has a link to the Multnomah County resolution that they passed that goes a little bit further. But I think it is a good strategy for us to continue to talk about and have kind of in our list. The work that was presented to us, the OAC presented, is it House Bill 4052? I'm blanking. Did I say the right word?
Perfect. You didn't blank.
Numbers? Yeah, so I was involved in some of the early equity group. Leslie Gregory,
Wow.
who
Yes.
kind of was the brainchild for that work and has been working on racism as a public health crisis being known and aware, like at the national level, was involved. But it did kind of happen like that, where I know there were multiple county commissioner groups that did resolutions on the way to it becoming a bill, to kind of show that there is support on the way for it to become a bill and back that work. So I do think that is a strategy that, we should look at.
Great. Thanks, y'all. And probably just to clarify, I think if I'm understanding this correctly, and staff, please correct me if I'm wrong, board or committee members and board members can participate in that advocacy to request, whatever group, boards of commissioners, city councils, to pass resolutions in support of this work. That is not necessarily work that we are doing officially as a committee or as a board. So just two separate threads, like there's multiple ways to engage, and so just wanted to make sure that was clear. John, did you have another comment?
No, I appreciate that last point that you just made, and I just wanted to add to what Amy said. I guess one thing that's looming in the background for me, just thinking about this specific type of outreach that we're discussing now, is going back to something you said earlier, Michelle, which is leaning in at the idea of, as a group, we should be leaning into those situations where maybe we know that we at some point may make contact with a city council or a group of county commissioners that aren't necessarily bought in. And I think we need to welcome the opportunity to hear from those communities as well. I think we can certainly find plenty of receptive audiences, Lane, Benton, Multnomah, obviously, right? And then, but I think if we're going to do, if we're going to do this kind of work right, then we ought to be willing to also show up in places where maybe the reception will be a little bit more mixed. But at least you talked about our experience outside this community, and say the power of showing up is really important. I think it really means a lot to show up at a place where you know that you're not going to have universal acclaim for something at first. And so if you're just there to listen, to share information, that can be pretty meaningful.
I would just add that
Yeah.
we were pleasantly surprised that it was a unanimous vote in Lane County. That was not, I don't think, what any of us expected, because Lane County has because of the mix of commissioners and how they vote historically.
Yeah, great. Really appreciate both of those points. And I think it's also a great reason to engage with the League of Oregon Cities and the Oregon counties, so that because they represent everyone across the state, all of those entities, and we can really hopefully get some helpful feedback there. So amazing. Y'all are such a dynamic group, and really am excited about how much dialogue we've had today, and how active this committee is. I'm so grateful. Amy, did you have something to add?
Oh, when you said that, and I'll add it to the list, but CLO, the county, I forget what it is, but it's like the group of counties that are they're basically the public health departments, would be probably a good place to connect to get like in the county door. Because like I said, it took someone who worked in the county to get it on the agenda.
Excellent. Grace, and then I'm going to turn it over to staff for the next item, or
Okay.
to Amy.
Okay. I just wanted to add, Amy, I do know CLO, so that's a community of local. And definitely, I think that would be a great resource because they really specifically focus on rural outreach. So I think they're a great connection. And I do have some personal connections as well if needed. And I just wanted to offer one suggestion for the last question about what topics or subject areas do you feel you need to learn more about? And something that came to mind was just inviting pioneers of universal health plans in Oregon. I know some of those are, some people are present here today in this room. So I'd really love to know about some of the barriers and just thinking ahead with planning. I just finished my project management certificate, or I'm going to finish it in 1 week. So just thinking, trying to plan ahead of, how can we navigate this fork in the road? There are definitely going to be barriers, and I'm not the first, and I know that there are people in this room who know. So I'd love to hear more about that and kind of expand on those ideas.
Excellent. Thanks so much for your connecting points to CLO, which is super helpful, and also for that suggestion. So the next topic is maybe a continuation of this conversation. I'll pass it to Amy.
Yeah, I think we just, and staff helped me, wanted a better understanding of kind of what are the resources that we think this committee will need to help with budget planning and just having access to those resources. And as we staff can maybe talk more about adding consultant support for communications. We have Diana Bianco for the kind of community engagement point, but really the messaging and communication will be very important. So just if people have thoughts about resources we may need to accomplish our work.
Yeah, Amy, I think that's you've summed it up really well. As the board is looking to its first legislative report, which will be submitted in December, we've let the legislature know that in January we would love to present and give them some information, not just about where the board is right now. Can you all hear me? Okay, my computer just told me Zoom quit. So they'll be giving a presentation in January, we hope, and talking about future needs and resources. We have funding right now for the board to move forward for positions and for some support in terms of contractors to bring in for help. Like Amy said, we have Diana Bianco on contract now. We'll be looking at some additional support, both from the DCBS communications team and from an additional contractor to do some work. But thinking forward about the work that we want to do as a committee, are there any resources that you think the committee needs? And I will say that Chair Bianca has talked about, you know, what the timeframes are. And so the idea of resources, I'm saying that just to say the idea of resources is pretty broad, just things that you think would be helpful to the committee to have as a resource as we're moving forward and doing our work. You don't have to, you know, answer it right now, and we're kind of running close to the end of the meeting, but as you're thinking about what you foresee for the committee's work, is there any resources that you think we would need to have, either consultants on board or in different individuals, or I think looking at something that Mickey, I'm sorry, mentioned earlier about the possibility of being able to provide stipends. Our current legislation is a little bit opaque on that, and I'm not sure that we will be able to do it, but is that something that we should really be looking for the legislature, for us to inform the legislature that it would be helpful for our work?
Yeah, and it's best practices to provide stipends, so maybe hire her as a consultant. That would be a different way to do it. But it's just best practices to provide compensation for their expertise and lived experience. Thank you.
Appreciate that, Mickey. Okay, so I will turn it over to Michelle and Amy to close us out. And just to let everyone know, we were able to take a little bit of extra time because there was no one who signed up to provide in-person public comment.
Do we have any more slides, Katie? After public comment? Nope. So I guess I would just like to thank you all for coming today, your participation, helping us further the brain trust around this work. And our next meeting, maybe Jenny can remind us the date. I don't remember if we had to change it due to holidays next month.
We don't, but it is coming a little quickly. So our next meeting is December 11th. So that's 2 weeks from now instead of 4 weeks from now.
Oh, because we moved this meeting, or I don't remember what we did, but
I
yes.
think it was just how the first initial meetings before the end of the year played out for availability for everyone. But we'll have our meeting on December 11th, and then after that, we'll start the calendar, the 2025 calendar. I think we meet every, oh, Katie, help me.
The fourth Wednesday of every month from 12 to 3.
Wednesday of every month. Thank you.
And everyone should now have that on their calendar as well.
Thank you, Katie. And I do want to say administratively, so after the meeting, we will work together on putting together the meeting notes for everyone, that everyone will get to see, and all of the materials will be collected, and we'll make sure that everything that we talked about during the meeting, all of the materials that we said we would post or send out will be provided to committee members or posted to the website.
Thanks,
you all.
Thank you, everyone. I hope everyone has a nice, restful, and I hope you have days off next week to rest and rejuvenate.
Happy Thanksgiving. Thank you.
Thank you.